All right, thank you all for attending this introduction to Medicare presentation today to learn about how it may apply to you. So we welcome you so much for coming. This presentation is presented by Western Connecticut Area Agency on Aging, hosted by Cheshire Cultural Diversity Association. 非常感谢大家来参加我们关于 Medicare 的知识讲座。那这个讲座呢，是由 Western Connecticut Area Agency on Aging， 简称 WCAAA 主讲，由 Cheshire Cultural Diversity Association， 简称 Cheshire CCDA 组织。那 Area Agency on Aging 呢，是拿政府拨款的非营利性组织，是 Medicare 官方指定的资讯机构之一。Cheshire CCDA 呢，也是一个非营利性的组织。这个组织成立的目的呢，在于帮助我们移民群体能更好的融入当地的文化与生活。Cheshire CCDA 呢，也会尝试举办不同主题的知识性讲座和文化交流活动。今天我们很有幸邀请到 Western Connecticut Area Agency on Aging 的 Medicare 资讯专员 Paula 和 Daryl。Paula 呢是此次讲座的讲员，那 Daryl 呢会辅助回答问题。讲座结束以后呢，如果大家有问题，可以在 chat bar 里面把你们的问题打进去，那我会把它翻译。你可以用英文来问问题，我可以读给他们，因为只有我可以听得到看得到。那如果你要用中文提问呢，也是可以的，我可以把你的问题呢翻译给他们。我呢是今天的翻译因为 Medicare 也不是我的专业，所以翻译的不足之处呢，也要请大家多多的包涵。下面我要把时间交给 Paula。Paula, now time is yours.
Hello, everybody. I'm going to start by sharing my screen. Can you guys see it?
Yes.
Perfect.
Yes, we can see it.
Alrighty. Good evening, everybody. I want to thank you so much for taking the time to join us this evening. Like Lee was saying, my name is Paola Vargas. I am a choices counselor and an information and benefits specialist with the Western Connecticut Area Agency on Aging. I'm designated to help older adults in the greater Waterbury area, and I'm so happy to be able to reach such a wonderful community here in Cheshire. I am presenting with my coworker, Daryl Willenbrock. I have been with the Western Connecticut Area Agency on Aging for 3 years, and Daryl has been with the WCAAA for over 10 years, I believe 12 currently. So she's very informed about Medicare and benefits, and we're happy to be able to share some information with you guys. Today's presentation is titled, Welcome to Medicare, Understanding Your Options. It is presented by us, the Western Connecticut Area Agency on Aging, and has been organized by the Cheshire Cultural Diversity Association. And we want to give them a big thank you. So let's go over the agenda. The first thing we will do is we're going to introduce the Western Connecticut Area Agency on Aging. Then we'll go over the Choices Department and the program and what it entails. Then we'll go over a brief overview of Medicare. And then the last portion will be dedicated for questions and answers.
那今天呢他要讲的呢是，首先呢是要介绍一下这个 Western Connecticut Area Agency on Aging， 然后呢他还会给大家介绍这个 Choices Program， 然后接下去呢就会讲一些 Medicare 的基本知识最后呢就是提问。
So we are the Western Connecticut Area Agency on Aging. Our abbreviation is WCAAA. We are a private nonprofit organization, and we are one of 5 area agencies in Connecticut. We serve older adults through many federal and state programs, such as Meals on Wheels, the Home Care Program for Elders, Senior Medicare Patrol, and Choices. And we cover 42 towns in total in the Northwest region of Connecticut. That includes Waterbury, Wolcott, Cheshire, all the way out to Danbury, Brookfield, and Reading, all the way up closer to the Massachusetts state line, Salisbury, North Canaan, and Sharon.
Okay, Area Agency on Aging 呢是拿政府拨款的非营利性组织，那这个组织呢在康州有5个分部，Western Connecticut 的 Area Agency on Aging 呢，它管42个 town，它的分管的区域呢在这个图上的蓝色区域显示，北至 North Canaan， 南至 Danbury。然后东面呢到 Cheshire 都是他们的服务范围。这个组织呢不仅有 Medicare、Medicaid 的咨询服务，还有其他为中老年人服务的项目，比如如何申请政府资助的家政服务啊、送餐啊，还有一些比如说billing 的一些你的 Medicare 就是出现的一些billing 的这些纠纷问题，他们也可以来协助解决哈，而这些服务都是免费的。
I would like to know why right now our staff does not speak Chinese or Mandarin, but we do have a tool. It is a language line. So you can request to speak with a choices counselor like myself or Daryl, and we can set up an appointment and have someone on the phone to translate. So we definitely can help all populations and all types of diverse clientele.
虽然呢，他们现在在这个办公室呢没有可以讲中文的，但是呢，他们也有这个中文翻译服务。如果你打电话去呢，所以也不需要担心，就是语言上面的一些障碍，他们有办法来协助这个问题。
So, the State Health Insurance Program, SHIP, is a federal program, so we can help Medicare beneficiaries with their benefits, signing up, and each state throughout the country has their own program. Here in the state of Connecticut, we refer to it as choices. It is an acronym, and it's for the Connecticut's Program for Health Insurance, Outreach, Information, and Eligibility Screening. Like mentioned, we help people who are at the beginning of the Medicare journey, who just turned 65, or other people on Medicare with whether it's questions about billing, about services that are covered, and upcoming changes for the upcoming year.
那么这个 Choices Program 呢，就是 Area Agency on Aging 下面的一个部门。他们这个部门呢，主要就是协助中老年人关于这个 Medicare 上面，如果你有什么问题的话，他都可以来协助你。你是不是符合申请啊？或者是你要选择，你 active 了你的 account 了以后，你注册登记了你这个 Medicare account 以后，那你想要选择什么样子的insurance 啊？你想要这个 original Medicare 或者是这个 advantage 的 Medicare， 他们都可以协助你来帮你选择。
Our contact information will be provided at the end of the presentation, so you'll be able to know where to give us a call.
在结束了以后呢，他们会把他们这个办公室的电话提供给大家。
Alrighty, so let's learn about Medicare. We're going to discuss what is Medicare and who is eligible. A lot of the times people confuse Medicare with Medicaid because they sound very similar, but they're two vastly different programs. So let's buckle in. So Medicare is a federal health insurance program, and it was created for those who are 65 or older. You don't have to be only 65. There are other ways to be eligible. So if you're under 65 but are collecting Social Security disability for at least 24 months or two years, you are eligible for Medicare. Or if you were just recently approved for Social Security disability and it's retroactive, then they will start you the following month. So that's one other way to be eligible for Medicare. Those who are diagnosed with end-stage renal disease are also eligible for Medicare. If you have been diagnosed with ALS or Lou Gehrig's disease, again, you will receive Medicare benefits the first month after you've been approved. You must be a U.S. citizen or a lawful permanent resident.
OK，他说呢，就是 Medicare 和 Medicaid 呢是不一样的。Medicare 呢是联邦的健康保险哈，65岁或65岁以上美国公民或合法永久居民，那么是可以申请的。如果你是65岁以下，但是在领取国家的残障福利哈。就是如果你是一个残障人士，如果在领取这个国家的残障福利，24个月以后呢，你就可以转到这个 Medicare 里面。还有呢，就是如果这个患者他诊断为晚期的肾病需要做肾透析啊、肾移植的这一类患者，也是可以申请 Medicare 的。还有一种呢，就是肌肉萎缩症，就是我们说的渐冻病的患者呢，在领取国家残疾福利开始当月就可以自动获得 Medicare 的 Part A 和 Part B。
So in short, Medicare is health insurance for those who are 65 or older or on disability. So when and how to enroll into Medicare Part A as in apple and Part B as in boy. Enrollment into Medicare is handled by Social Security Administration. If you turn 65, you do have to call Social Security. You can make an appointment with your local Social Security office or call and make an appointment over the phone to activate once it's your turn, once you turn 65. If you retired early, then you will automatically receive Part A on your 65th birthday. When you should enroll, so if you turn 65, let's say in January, you have 3 months before your birthday, the month of your birthday, and 3 months after your birthday. So if your birthday is in January, you can call the beginning of October, November, December, January, and then you have 3 months afterwards. So that's February, March, and April. Then there's what's called the general enrollment. If you have not enrolled in your initial enrollment period, you have another opportunity from the 1st of January till the end of March, March 31st. And what will happen is your coverage will begin the 1st of July. It's very important to avoid this. When you don't enroll during your initial enrollment period, you are going to face late enrollment penalties. And what happens is they assess and calculate based on how many months or years you've delayed enrollment. There are special enrollment periods. That is, for example, if you turned 65 but kept working and received some benefits through your employer, you have 8 months after your last day of work or the last day of your health insurance coverage to enroll into Medicare. Another example of special enrollment period would be if you move from one state to another. If your plan for whatever reason no longer existed. So there are options if there should be a special reason for you to enroll into Medicare.
OK， 那这一章呢讲的是，如果你正在就是什么时候你需要注册登记 Medicare 的 Part A 和 Part B。登记 Medicare 呢，不是联系 Medicare， 而是要联系 Social Security 社会保障局来激活和注册你的这个 Medicare account。OK， 如果你正在领取社会保障局的福利，那么在你65岁生日前呢，你会收到社会保障局给你寄的信，关于你的 Medicare 的登记情况，会在那个信上面告诉你。那如果你没有领取社会保障局的福利，那么你需要主动的来联系社会保障局。什么时候联系呢？你可以在65岁生日前的3个月和65岁生日当月，还有就是65岁生日后3个月 你可以联系登记，可以打电话到这个 Social Security 上面有800-772-1113，也可以在网上面办理。那么他说我看哈 ，initial enrollment period 是刚才我讲的，然后那个 general enrollment period 就是如果你错过了这个 initial enrollment period， 就是这个7个月的这个窗口期，如果你错过了以后呢，你就要等到下一年的1月1号到3月31号，这个 coverage 呢会在7月1号才启动。那么如果你错过了这个初始的这个首次符合条件时，你没有注册，然后你之后又反悔了，你又想去注册了，那这种情况下你是有可能会被罚款，不是完全会被罚款，是有可能。那么还有一个注册期呢，是叫做特殊注册期，就是 special enrollment period。那这个 period 呢是8个月的时间哈，这8个月的时间呢，就是在你就业结束，或者是你的健康保险，就是你的公司提供给你的健康保险结束后的1个月开始，那么以先发生者为准。比如说你就业先结束了，那么你就业结束后的这1个月你就要开始注册。如果你的保险先结束，那么就保险结束后的1个月开始。还有呢，这个特殊注册期也不仅仅是给就是在职的人，的一个特殊的注册期。他当然了，他还提到，就是如果你要是搬家，从一个州搬到另外一个州，或者是你的insurance有变化，那都是符合的。其实还有很多很多的其他的这个情况都是符合这个特殊注册期的。以后我们的这个还会有讲座，会详细的讲这个特殊注册期哈。
So now we know who's eligible for Medicare, when and how to enroll into Medicare. Now we're going to discuss about exemptions when you wouldn't need to enroll into Medicare. So if you are 65 and plan to continue working, you might have some exemptions for Part B. So if you're covered by an employer health group plan based on active employment, you could be exempt from Part B and you would have credible coverage. The requirements are your company must have 20 or more employees to defer enrolling into Part B. If you're on Medicare due to disability, your company must be more than 100 employees. If your company is a small company and has under 20 employees, you should enroll into Part B because you will receive a penalty if you do not. It is very important to note COBRA or retirement insurance are not considered active employment insurance. So it has to be through an employer and it can't be COBRA. And this is just deferment of Part B. Part A is free for everyone who's worked at least 10 years or 40 quarters. So when you're 65, it's okay to enroll into that since there is no charge, but Part B can be delayed.
OK， 那这一章呢，就是讲什么情况下你可以晚注册这个 Part A 和 Part B 哈，你或者是你的配偶一方需要正在就业，那么如果你的雇主有提供这个健康保险，你可以就是晚注册，但是呢，这公司的大小也非常有讲究，公司必须要有20名或者更多的员工。如果你是残疾人士的话呢，你这个工作的单位需要有超过100名的员工，你才可以推迟参加这个 B 部分。如果你的公司 size 比较小，就是少于20名，你是残障人士，你的这个 所在的工作单位100名以下，你没有注册 B 的话，以后你要想再注册 B，那么会被处罚的哈，有可能会被处罚。如果你有 COBRA 或者是退休的保险，但你现在并不在工作，那你也是需要注册登记 Part B 的。Part A 呢，就是不是对所有的人都是 free 的，基本上就是你要在美国工作10年或40个季度，你才可以得到免费的哈。
So let's break down exactly how to activate your Medicare. It can get really confusing. And unfortunately, when you turn 65, Social Security and Medicare will not reach out to you. So it is your responsibility to do your due diligence. But it's okay. We're going to give you guys the information. So the first step, like I mentioned in the previous slide, you have to contact Social Security Administration. You can call the nationwide phone number or your local office. Both numbers will be provided at the end of the slide. You ask to activate your Medicare Part A or B or both. If you're going to be receiving retirement benefits, please contact your HR department. The rules are a little bit different if you are working, if your employer is going to offer you retirement benefits, including your health insurance. So once you've called Social Security, let's say it's 3 months before your birthday, you would receive your Medicare card in about 30 days, and it would have the start date on the card. It'll say Part A effective the month of your birthday and the year that you're enrolling in. The next step is to call us, call Choices, and have a counselor help you with the following steps. Medicare has several different parts, and a Choices counselor's responsibility is to help you search for your prescription drug plan, known as Part D, and other options like a Medicare Advantage plan or supplemental insurance. After that work has been done and you've been presented non-biased information, you would make a choice and enroll into your Part D or Medicare Advantage plan. And that's it. You did it. It's really simple when you have help from us, the Choices counselors.
OK， 这一章呢讲就是如果你要登记激活你这个 Medicare 哈，就是你要想激活你的 Medicare account， 你不是直接先打电话给 Medicare， 你要先打电话给社会保障局哈 Social Security。如果你有退休，你的那个工作单位有提供给你退休健康保险的话呢，你一定要先去咨询你的 HR department， 人事资源部哈，你一定要对比一下 Medicare 或者是你的这个你公司给你的退休健康保险是哪个好。比如说你在耶鲁大学上班，然后你退休了，那么耶鲁可能会给非常非常好的退休健康保险，也许你不想要放弃那个，如果你放弃那个注册了 Medicare， 很有可能你到时候想要回到你原来的这个耶鲁的退休健康保险，那你是不可以的。在你这个打电话给社会保障局登记注册了以后呢，差不多30天的左右吧，你会收到一张这个蓝红卡。之后呢，你收到蓝红卡，你有这个 Medicare 的账号了以后呢，你可以到 Medicare.gov 登记处方药计划呀，你也可以自己在这个网站上面对比更换 Advantage Plan 啊。当然了，最放心、最省事儿的，那么你就是打电话给这个中老年服务咨询中心，就是 Area Agency on Aging。那他们会按照你的个人的情况啊，会给你很多很好的建议和帮助，这些服务全都是免费的。
So these are your available resources. Like I mentioned, the first number is the Western Connecticut Area Agency on Aging. Like I mentioned, we cover the Northwest region, so anybody from those towns can call this phone number, 203-757-5449. Our specific extension is 134. So if you call that main number and then press 134, a Choices counselor will be able to help you. Now, Choices is statewide. So maybe you have a family member in Eastern Connecticut, Southeast Connecticut, or in an area that we don't cover. They can call the SHIP hotline, which is 800-994-9422. We also put Medicare's phone number, which I should mention, Choices counselors have a hotline where we can call Medicare directly, and that can help expedite the process. So I think preferably you should give us a call. We also have some websites linking you to Social Security, the Center for Medicare Advocacy. So if you have questions about if a service is not covered, if you have been treated unfairly in a medical facility, this is the place you'd want to reach. There's Elder Care Locator and the National Council on Aging. These are all wonderful resources, open and available to your disposal.
那 Paula 呢 list 了一些，举了一些，就是可以给你提供这些帮助的网站哈，这些网站都是，如果你要是有 Medicare 相关的这个问题，这些网站都是可以给你一些信息。WCAA 呢，就是我们刚才就是介绍到的，这是一个拿政府的资助拿政府拨款的一个非营利性的组织。那么它分管的区域呢，刚才在那个蓝图上我们有显示，如果你所住的区域在他们的这个管辖范围之内呢，如果你有关于 Medicare 方面的需要得到他们的帮助呢，你可以打这个电话203-757-5449，他们的分机号呢是134，在这上面没有写到，因为他刚才讲到了他的分机号是134。如果你不在他们的管辖范围之内呢，你也可以打电话到1800-994-942，1800-994-942。那么这个呢他是管这个整个 Connecticut 的，你告诉他你所在的区域呢，他会把你就是介绍到你所在区域的那个 Area Agency on Aging 的这个部门去。他下面还举了一些 Medicare Medicare.gov SSA.gov SSA.gov 就是我们刚才讲的社会保障局如果你要是想要注册激活你的 Medicare， 你需要联系这个社会保障局。那么它下面一个是 Medicare Advocacy.org， 那么这个组织呢，他们有自己的律师团队，他们可以协助老年人解决一些医疗纠纷问题，比如说你的账单的一些问题，你觉得不合情理，他们乱收费了或者什么，那么你就可以到这个网站上面找寻一些帮助。下面一个是 Medicare Interactive.org， 那么这个网站呢是一个非常好的学习网站在这个网站上呢，你可以学到很多关于 Medicare 的知识。接下来一个是 eldercare.gov，eldercare.gov 呢，你可以在这个网站上面找到很多家政护理的一些信息。在接下来的是 MyMedicareMatters.org， 这个网站上面呢，就也是提供了很多关于 Medicare 相关的知识的一个网站，比较综合性的一个网站。
So again, we just want to reiterate some house rules. We are the first door to Medicare. So if you have questions, please call Choices at the Western Connecticut Area Agency on Aging. Due to the COVID-19 pandemic, we are not accepting in-person appointments or visitors. We are available via phone or even Zoom, very much like this, and we will provide unbiased, free one-on-one counseling. You can always give us a call Monday through Friday from 8 to 4 p.m. The Medicare open enrollment actually just ended. It does run between the 15th of October to the 7th of December. The Medicare Advantage open enrollment is coming up the 1st of January till the end of March 31st. So if you have one and you have questions, please give us a call. Like I mentioned before, Choices is statewide. So if you have a family or friend who lives outside of our jurisdiction, they can call this 1-800 number and they will be referred to the proper area agency on aging. But if you're under our jurisdiction in the Northwest region, give us a call at 203-757-5449, extension 134. Not only do we help older adults understand Medicare, but we look to you to help us. In the spring, we always have a Choices training, so we could teach you all you need to know about Medicare, and you could help others by explaining their Medicare choices. Like I mentioned, you can call this phone number and ask to speak with our regional coordinator. And like I said, that's in the spring. And we ask after this presentation, whenever you get the chance, if you can fill out a survey, giving us your opinion about what we did well and what we can improve on, it would be greatly appreciated. I want to thank you guys so much again for taking the time to meet with us. And now I'm going to open up the floor for questions after Lee translate, of course.
OK， 那么他说，现在因为在疫情期间呢，他们这个 Area Agency on Aging 呢，现在这个办公室是不对外开放的，但是呢，可以打电话，他们也可以安排这个 Zoom 的1对1的这个 meeting 哈，他们是8点到4点，星期一到星期五，是上班的时间，他提到 Medicare Open Enrollment Period 每一年的10月15号到12月7号，当然现在已经结束了。在这个期间呢，如果你想要就是你有这个 Medicare Advantage Plan，你可以就是做一些改动啊，或者是你的prescription 这个处方药的一些处方药的这个 plan， 你想要做一些更换哈，在这个期间里面都是可以做更换的。他们也鼓励大家打电话给他们，因为他们就是春天的时候他们会有培训，专门针对 Medicare 这方面的这个培训，他们很欢迎大家打电话给他们，跟他们一起来学习。下面呢就是他又列举了这个 statewide 的 choices， 就是的电话号码和他们 Western Connecticut Area Agency on Aging 的电话号码。如果你不是在他们这个 cover 的这个区域之内呢，你打电话到前面这个 1-800 994-92-1800-994-9422，你打电话到那里去，告诉他们你所住的这个城镇，然后他们会告诉你需要打哪个电话。他们也希望在这个讲座之后呢，如果你可以填写他们的调查表，他们非常非常感谢，他们也希望得到一些就是你们的反馈，听完讲座这个反馈。
And that's the end of this presentation. And it's time for some questions if there's any in the chat.
OK， 现在呢是那个提问的时间哈，你如果有提问的话呢，你可以在这个 chat box 里面呢把你们的问题打进去，你可以用英文提问，也可以用这个中文提问哈，我会读给他听，然后呢他会来回答。这里有一个人提问呢，就是I have one question here. What is the agency for New Haven County? I think the answer is she has to call 1-800-994-9422 9422, right? And tell them where she lives, and they will tell her the correct office that she has the contact, right?
And if she has a problem, she could call our office and we can give her the direct line.
OK，就是有人问 What is the agency for New Haven County 呢？你可以打电话给1800-994-9422，也可以打电话给这个 Western Connecticut Area Agency on Aging 呢，他们也可以来帮你就是找到你所就是负责你们这块片区的这个 office， 他们的电话呢203-757-5449，分机号码134。
One thing I will mention is we don't go by county. So New Haven County includes Waterbury. So Waterbury is under our jurisdiction, but New Haven County can encompass towns that aren't in our jurisdiction. So it goes by town line. So it's important. They can always call us and we could tell them where to call directly, but it's not necessarily, we cover Litchfield and New Haven, but it's
And a couple of towns in Fairfield.
Exactly. So it's better to just call based on your town. So when you call in, you say, I'm from, let's say you're from West Haven, we'll know, okay, this is the area agency on aging for you. If you're from, I don't know, in the Hartford County area, we'll know based on your town.
OK， 说他们呢，就是说他们这个5个这个办公室呢，他们覆盖的服务区域呢，不是按照这个county来划分的哈。所以还是打一个电话给他们会更加好一点点。I have another question. This person wants to know the function of this Medicare. What does Part A and Part B mean?
So Part A is your health insurance for hospital services. And Part B is for inpatient doctor services. So when you go to the emergency room, that is your Part A coverage. But if you go see a doctor, a specialist, have to do blood work, things like that, that's Part B. So your Medicare is your health insurance, and the Part A and Part B just decide exactly what they cover specifically.
OK， 那么他说呢，这个 Part A 呢，主要是你就是住院的时候产生的费用哈，那也不是说完完全全就只是 cover 这个住院哈，它还有 cover 一些其他的，但是大致来讲呢 ，Part A 是支付你这个住院的费用 ，Part B 呢就是支付你家庭医生的这些费用。
Hey, hello. Can I ask a question?
Hello?
Yeah. Hello?
Hi, I have a question. Hello?
我们建议你如果有问题的话呢，因为我们的时间哈就是就是也是。
Oh, can I ask a question?
Sure.
Can sure.
Yes.
Okay. Yeah, because when I look at online, they all say that you have to enroll Medicare, even if you're still working and your employer provides a health insurance. But now the lady just said that if you are active employed, then you can wait until you retire. So I just want to make sure that like in Connecticut, people can actually enroll Medicare after they retire.
That's not just in Connecticut, that's nationwide. The law says if you have what's called, and the key word is credible coverage.
Yeah, I understand that. Mm-hmm.
Okay, then your company is fully covering you. You are exempt from enrolling until you retire from the company. And then you have 8 months from your date of retirement to enroll in Medicare Part A or B.
Mm-hmm. Okay. All right. Thanks. Okay. And another question, I don't understand what is the function of your agency, because you are not an insurance company, right? So when I purchase, I don't know like what services this area of agency of agent provides, like, because I thought I just need an insurance company, right? But it sounds like your agency also provides some kind of service.
That is correct. The area agency on aging are carrying out what the state unit of aging would like to implement, which are different programs. Like I mentioned, there are programs like Meals on Wheels, which provide prepared meals for those who are homebound. We have the home care program for elders for those who are at risk for nursing home placement, which would allow you
I
to.
see.
Yes.
Oh, I
So
got it.
Choices is a department with under the Western Connecticut Area Agency on Aging, and we are not health insurance brokers or sales agents.
We're
I got it.
unbiased. We
Mhm.
don't get paid by anybody to pick any particular insurance. Any insurance agent you're dealing with is getting a commission. So you want to make sure that he's not trying to sell you something that his company sells. That's why we ask you, call us first, and we can present you with a variety of options. We gain
I
nothing
see.
by doing
I
this.
see. Okay. All right. Thank you very much.
Thanks for calling.
Daryl, I want to ask because she asked if she's still working after 65, right? If she has credible coverage, but does that apply to this situation if the company less than 20 people?
Correct. Then they have to apply for Medicare.
Even though she has credible coverage, right?
Right.
Okay.
I don't know why they have that law, but then generally when I find out more about Medicare, I don't know why they have a lot of the laws they have. But yeah, it has to be a company over and above 20 people.
Okay, so 刚才我不知道是谁提的问哈，就是你一定要知道，虽然你在上班，你有这个公司提供给你的 credible coverage， 但是你公司的这个 size 大小，是非常非常重要的。如果你要是这个公司少于20名员工，或者如果你要是残疾人士，你的公司少于100名员工，你还是需要去注册和激活你的跑币的哈。
Oh, wouldn't that involve coordination of benefits if you had a plan at work and also had Medicare? You know that?
It doesn't necessarily have to. Like sometimes your HR department knows how they want it to work. If they want Medicare to
Right.
work, pay first or pay second. But if there's, I'm trying to think where there are certain circumstances where more than one company is involved.
Yeah.
And lots of times then we have to go to outside of our office to
Right.
get them to come in and coordinate the benefits. Yeah, we don't.
I'm aware of
we see-
that function of coordination,
Right.
just so you know there is such a thing. That's all.
Exactly.
Yeah. Okay, Brandon. I thank you so much for your question. We have to stick to the rule that we cannot allow people to turn on their everyone has to stay mute. Okay. So the question has to come from the chat box. Okay. So we can control the time. So next one is what is a plan B for? We just discussed, right? Plan B, the Part B is for 你的 Part B 就是主要是 cover 你的家庭医生这一块的费用。Can you talk more about Advantage plan? But are we going to have another presentation that we're going to compare original Medicare and Advantage plan, right? Because this is a complicated topic.
Yes, we definitely will have a meeting just dedicated to the difference between Medicare Advantage and original Medicare. But in simple terms, Medicare Advantage is a private version of Medicare. There are private health insurance companies that are contracted through Medicare to provide the same exact services, maybe a little, the way that they operate is a little bit different, but it's just a private version of Medicare. And the rules are a little bit different, but we'll talk about that more later down the line. We don't want to confuse too many people, but it's an alternative to Medicare. They are HMOs and they're PPOs, so which stands for Health Maintenance Organization and Preferred Provider Organizations. So they have different rules as well.
OK， 这个 original 他刚才解释了，这个 original 这个Medicare 呢是一个政府提供的保险哈。Advantage plan 呢，你也可以 你也可以买，就是你可以买政府的这个 original Medicare， 也可以买这个私人的这个保险，就是 Advantage Plan。但是这个 Advantage Plan 和政府提供的这个 original plan 呢，也是一个非常非常大的一个 topic。我们可能会专门开一个讲座来专门讲的对比哪一种保险更适合你。Let's see the next one. Okay, let me read to you. Okay, my husband is approaching 65 years old. I am younger than him 10 years. I'm still younger. Is it a good deal? I'm not quite sure of this question. He should claim his Medicare. Myself stays in my company's health insurance. Okay, I think I got it. I think she is saying that her husband is turning 65, but she is 55 around. If his husband should claim Medicare and herself still stay with the company's health insurance.
Is he on her insurance? Or do you know that?
I don't know. She didn't provide. Let me see. Whoever wrote this question, 你可以把你的那个叫陈琳，你可以把你的这个 voice turn on， 可以直接问吗？
If he is on it, he can remain on it. If she's still working, it's fine. That rule of it's either a husband or a wife, a husband or a spouse, or a wife or a husband, whatever way it goes. But yeah, if she's providing the benefits and he turns 65 before her and she intends on working and providing that benefit, then he can stay on it and he is not mandated as long as it's credible. And she works for a company that's over 20 employees. He does not have to sign up until she retires.
Okay.
I think the question is if she should do it. I think it depends, right? And she could call us, right? And we would show them the options of just original Medicare, how much it costs. Sometimes the employer's benefit offer a couple different things that original Medicare doesn't, and it doesn't cost the spouse too much to have their husband on. And then they could choose to do that. But for some people, it might cost too much to keep your husband on your insurance, and it makes sense to go to original Medicare. So it depends. But like Daryl said, he can, but when the time comes, he would have to weigh out costs and what's covered and what's not covered.
And I think Paul is right. It's good to call us, tell us what your options are. Like if she could tell us what the cost of her insurance is, then we can at least do a probable cost for him. And then, it's the lesser of two evils, right?
那么回答这个问题呢，他们强烈建议你呢，就是打电话给他们办公室，因为他们还需要一些更具体一些信息哦。当然，您的丈夫呢可以，如果您的丈夫跟着是他的保险呢是跟着您的，那么他还是可以继续的跟着你。那么他当然也是可以。单独的去 sign on 这个 Medicare 的，但是这个费用上面呢需要做一些对比，所以的话我们还需要有更多的一些信息。你可以打电话，就是刚才给的那个电话，一会儿我还会再报给你们一下哈。The next one, I think people confused about enrollment period. January 1st to March 31st or October 15th to December 7th.
Okay. So if you're on Medicare, everything's signed up, your open enrollment is the 15th of October to the 7th of December. What you're doing during this time period is taking your current plan, whether it's a prescription drug plan or a Medicare Advantage plan, and seeing what the projected cost is for the upcoming year. and comparing it to what other options you can switch out to. So it gives you the option to switch out the upcoming year if there's something that covers more for less amount of money. Now, if let's say you didn't enroll in the time that you were supposed to, and you wanted to activate your Part B, then January 1st through March 31st, you can do that. And then the coverage will start in July. It's for those who did not activate in time in their initial enrollment. But open enrollment, the 15th of October to the 7th of December, is for those who have all the parts of Medicare and are looking to possibly switch.
OK，他呢就是说，1月1号到3月31号呢，是如果你错过了你这个初始的这个 enrollment period， 就是我们刚才所说的7个月的这个窗口，如果你错过了那个注册期呢，那么你就要你又不符合这个 special enrollment period 呢，那你就需要等到这个1月1号到3月31号来注册。10月15号到12月7号呢，是已经注册了这个 Medicare 的人呢，可以在这个期间来做一些更改，比如说你觉得你这个 plan 付的钱多，你想要换到另外一个 plan， 那这个期间呢，你就是可以来做这些变更。Next question is, does Medicare include dental?
No.
OK，
It does not.
So 他说呢，就 Medicare 是不包括这个牙医的哈。那么 Advantage Plan 呢，它是有的呢是包括这个牙医的，这就是为什么很多人喜欢这个 Advantage Plan， 但是也是有好有坏哈。根据不同的人，你要选择不同的这个plan。我们下一次会组织这样子的 presentation， 专门讲这个 Advantage Plan。Okay, next question. You can still enroll in Part B even if you are in a group health plan. The answer, I think, is yes. You can have both, right?
Yeah,
sure. Yeah. 就是你是可以的哈，可以同时的。就是我们刚才讲的，你的公司如果小于20人，或者是残疾人是小于100人的话，你是需要注册这个 Medicare 的。但是你同时也是可以有你的 company 的 group health plan 哈。但是的话，到时候就是付账的时候是谁先来付的话，也是非常有讲究的。那以后我们都会来继续的来学习。你再看下面一个哈。
You just want to let everybody know that there is a charge for Part B. Next year it's going to be 170. Do you remember what the cents is, Paula? Is it 170.45? Huh?
10 cents, I believe. So
yeah.
$170.10.
So it's costly. It's not cheap.
I think someone just want to verify the coverage from Part B. Part B is
it
covers
your doctors, your medical equipment, your X-rays and lab work.
OK， 那么他说呢 ，Part B 呢不是住院哈 ，Part B 是你的家庭医生啊，或者是就是你生病了必须要用到一些医疗器材啊，X-ray 啊，或者是就是验血啊这一类的这个 lab work， 就是 Part B 是 cover 的 ，Part A 是 cover 你这个 hospital 的费用哈。
Also, they shouldn't worry too much because when they get Medicare, the card says Part A and Part B. They don't have to show any different card. All they have to do is show the red, white, and blue card when they go to the doctors or the hospital. There's no different process. The hospital or the doctor should know how to bill Medicare and how to bill it to them depending on the service.
Yeah, the only time it would become a problem is if they are going to a nursing home. They have to make sure they have if they have original Medicare a 3-day inpatient stay and not a 3-day stay under observation status. But that's a whole nother topic we can go into. But it's
Yeah.
very important.
Mhm. So the next question is, I was checking the Medicare enrollment and it was brought to the marketplace, Access Health Connecticut, SAT. It says that the enrollment runs through January 15th of 2022, but I heard that Medicare enrollment just ended. Can you explain the differences?
So what, yep, thank you. So what happens is when you turn 65, you are no longer able to purchase health insurance through the access place, the marketplace anymore. So yes, that is the open enrollment for someone who is 20 years old, 30, 40, 50, 64. Whether it's just the health insurance your doctor, your employer offers is not that great, or you don't have an employer to offer you health insurance benefits, you can go through Access Health until the 15th and pick a plan. But once you turn 65, you're not able to use it. So there are several different open enrollment periods for different types of people based on their age.
那他解释呢，就是说，如果你一旦是转到就是65岁了以后呢，你是不可以在这个 marketplace 来买这个 insurance 的，你需要在 Medicare 来 enroll 到这个 Medicare，刚刚结束的呢，就像我们刚才解释的，10月15号到12月7号呢，并不是 Medicare 的 enrollment，不是就是你新注册的这个 enrollment period，只是你如果已经有了这个 Medicare，你想要做一些变更的话，你在10月15号到12月7号之间，你可以做变更。但是如果你错过了这个 initial enrollment period，你现在想就是enroll into 这个 Medicare 呢，那你就要等到1月1号到3月31号哈。So the next question is, okay, that's the question that I asked you this afternoon. If you work at China and the person has health insurance coverage through current employer, does she still need to enroll into Part B? And we found the answer where she has to call. 那这个问题呢，我下午专门帮你问过他们哈，你需要有一个专门的部门来管，就是 US citizen 在中国工作，在中国生活，那么65岁了以后是不是需要 enroll？ 你可不可以你可不可以拿到 free 的 Part B 啊？你需不需要 enroll？ 你可不可以得到免费的 Part A， 或者是你需不需要 enroll Part B？ 有个专门的一个部门来负责的哈。这个部门还不在美国境内，也不在中国境内，在菲律宾。我到时候会把这个电话号码和这个邮箱地址可以给你们，一定要专门要联系那个部门，他们会协助你的。
And I'm really happy you got that question. It's really important to know that we're well informed, but we don't know everything, and every case a little bit nuanced, and it's case by case. So give us a call if we don't know the answer. Our responsibility is to research and find you the answer or refer you to the right person, the next step. No question's a dumb question, that's for sure.
Yeah, I didn't realize it's almost 8 o'clock. We really have to stop on time. I'm going to read a lot, last question, but we still have like 20 more questions. I'm going to collect all the questions and send to you too. get the answer, I will post everything in the group chat. 那么，因为我们已经快到8点钟了，我们需要就是及时的结束哈。我们再跟他们问一个问题，我们还有我知道还有30条问题哈，没有办法回答，但是不要担心哈，我会把这些问题全部给写下来，然后告诉他们，然后他们回答了以后呢，我会把答案放到我们的这个微信群里面。那最后一个问题，我们来问，就是需要同时申请 Part A 和 Part B 吗？就是do we have to apply Part A and Part B at the same time?
No,
Not at the same time.
Oh. Go ahead.
No, Daryl, actually, Daryl can tell you. Daryl has all the answers, actually.
No, she doesn't. You don't have to apply for it at the same time. For many people, Part A is free. So if you're still working and you want to sign up for it when you're 65, fine, it doesn't cost you anything. I think the big holdup with everybody is because Part B has a charge to it. So if you're getting coverage and the coverage is adequate for you, then because of the expense of Part B, people like to hold off until they absolutely have to sign up.
OK， 那么他就是说，Part A， 如果你到了65岁，如果你这个 Part A 对你来讲的话是免费的，那为什么不去sign on呢？那你应该要sign on哈。但是 Part B 是要付费的，那么你就要衡量了。如果你公司里面给你提供很好的医疗保险，而且呢，你的公司的 size 呢是在20人以上，还有刚才也提到的100人以上，如果你是那个残疾人士的话，如果你已经有很好的 coverage。符合可以延迟注册 Part B 的，那就没有必要同时来注册 Part A 和 Part B 哈。Part A 什么时候注册也要根据你自己的情况。如果你现在已经工作了10年了，这个对你来讲是 free 的，那么你就注册。如果过1个月你就是 free 的了，那么你就再等1个月再注册这个 Part A， 好吧？ Thank you so much. So we're very, very glad to have you too. We're looking forward to the next presentation.
I enjoyed it. Thank you.
If I don't see you too before the holiday, I wish you and your family a happy holiday and a Merry Christmas.
Happy holidays and Happy New Year, everybody. Thank you so much. Thank you.
Happy holidays, everyone.
Thank you.
Thank you. Happy holidays.
Happy holidays.
Happy holiday.
非常感谢大家的参与哈。
Happy holiday.